Thank you all for joining us today. My name's Lindsay Page, and I am a physician that works with Baylor College of Medicine. I'm a geriatric psychiatrist, and today we will be presenting part of our dementia series that was created in partnership with the Montrose Center and the Southeast Texas Geriatric Workforce Enhancement Program. So what is the Southeast Texas Geriatric Workforce Enhancement Program, which we kind of abbreviate to the SEDEX-GWEP. And what we really do is, like this photo says, reach, teach, and innovate. We're a national network of providers, healthcare workers, community members who try to educate the public and other healthcare professionals about age-friendly care and specifically caring for our older adults. And so this presentation series, it's a 3-part. This is the 3rd part in the series. Maybe some of you have been able to catch our 1st and 2nd parts. We'll be also trying to kind of have these set up again for everyone to see in different locations at the Montrose Center. With the pandemic, we've been trying to kind of get these out in a Zoom format, but we're kind of working creatively on figuring out other ways to get the information to everyone too. So today, this presentation will be about care planning. And our title for this presentation is Care Planning for LGBTQ Adults with Dementia. And so again, this is the 3rd part in our series. And really what the series is about is specifically kind of helping educate the LGBTQ community about dementia and then specific considerations in the LGBTQ community. And so our first presentation kind of went over the introduction of really what is dementia, which that word a lot of us kind of associate with different things, but we found out, you know, the actual definition and really what are different types of dementia was something that a lot of people had questions about. So that was our first part. Our second part was about caregiving and the specific considerations of being either a caregiver of an LGBTQ person or being LGBTQ and a caregiver. And so all the different facets that go into that. And then our 3rd part today is about care planning. And we'll get into really what does that mean and why is it a part of this dementia series? And then also getting into care planning really also is something that's not only important in dementia, but important for all people as we all get older and kind of organize our care. And again, I'm Lindsay Page, Dr. Page, and then I want to give a special thanks to the Montrose Center, Richard Gomez, Nicole Sullivan, Bertie Nunez, and Jennifer Queen, who also helped in creating the series and coordinating getting all of these events sorted for you all. And so first, we're going to start out with our objectives for today. At the completion of this session, we're hoping that everyone should be able to define care planning in dementia, list common tasks in care planning, and then recognize important legal documents in care planning, and then describe specific LGBTQ considerations in care planning. And so what we'll keep coming back to today is our agenda, which kind of will help everyone not get lost and kind of see the progress we're making through the presentation. So we'll explore the definition of care planning, really what is it, why do we need to know about it, and why is it in this series about dementia, discuss the common tasks in care planning. We'll learn about the legal documents. That's always the biggest thing people have questions about, or people have misinterpretations of. I know I've learned a lot in my education about different legal documents and really what they are, and kind of helped even my own loved ones figure out the kind of ins and outs of those. And then, of course, look at the specific LGBTQ considerations. You know, why would this be a part of specific care planning for LGBTQ people and older adults? So kind of getting into that first item in our agenda, really what is care planning? So care planning in dementia is also called usually advanced care planning. So meaning that, you know, along the way, this is something that we're going to do, of course, before we get to the point of needing it. That's the point in a lot of the importance in planning and care planning, right? It's about talking about things that we may not need right in this moment, but that we're looking ahead, because we know ahead might get chaotic, might get difficult. And so having like the forethought to kind of start a lot of these things earlier is really going to help us once we're at that other point down the road. And so it's thinking, discussing, and recording future wishes and plans. It's also, like we just talked about, doing it's early. Early is a big thing here. And then it's going to involve a lot of different persons. It's going to involve the person with dementia or the person with the illness, and then other loved ones that are there as well and a part of the person's care. And so what's happening really, in our first series and our second series, we talked a little bit about the course of dementia. And we know that early on in the course that many people, it's really important to emphasize the autonomy the person with dementia still has, which is often still being able to talk about their wishes and plans, being able to make decisions, having what we call the mental capacity or capacity. And so oftentimes capacity is a big word in the medical field when it comes to where the legal meets medical. And so capacity often, the definition really is, does someone understand the choices they're making? And then of course, can put into words also and understand the kind of the end result of making those choices, what will happen after. And so early in the course, oftentimes people with dementia still have that capacity to either sometimes you make decisions about finances, make decisions about their end of life care. And so this is why in this early stage of the dementia, it's important to start this planning, because while the person still can participate in these things and make their choices and have that autonomy is really important, and respecting, but also giving them the best time to, and the best possible way to make the decisions that they can when they can make them, and understand all the parts of making those decisions. And so we'll get into a little bit more about what goes into care planning, like the tasks. That'll be coming up next. And so we'll get back to our agenda here and talking about discussing the common tasks of care planning and what goes into that. And so what we see right now is many a task, and they're kind of put in order with these arrows. So the first things first. What's going to happen with care planning are often sometimes difficult conversations, because early on, there's a lot of processing going on early on in the diagnosis of dementia. There's processing for the person, there's processing for the family. What is the diagnosis? And like we talked about earlier in our series, that diagnosis isn't made one and done. It's made with a lot of information, and it's made throughout conversations usually, and throughout doctor's visits, throughout conversations and exams with your doctor. And so, not only having to process that, but also then starting to process needing to start planning. And so planning early is important, again, right? Because we want that person to be able to have a say in what's going on with them. And so, and what will be happening in the future once they don't have that capacity to make those decisions anymore. And so talking about finances and future care. Does that person want to be at home for as long as possible? Does that person prefer, assisted living? Or a nursing home if they need that level of care? What are the finances like in terms of what finances are there for maybe long-term care? What finances are there for any kind of home health that might be important, or providers or caregivers coming into the home if the family member or loved one, right? We know that a lot of caregivers are not paid. They're loved ones or friends, family, chosen family who come in to help. And so a big part of finances are like, what do they have for other care outside the home that they can pay for? And then, of course, reviewing important documents like part of the finances, the bank statements, the different accounts that are there. And then of course the wills and the POA, which is a abbreviation for power of attorney. And again, we'll start talking about all the different types and other kind of documents on the next few slides. But of course, we will organize the documents. That's another important part. And having copies of those documents in important places, having multiple copies, because of at least when it comes to wills and power of attorneys, it's important to kind of have a copy with you in case, you are going to a hospital. Unfortunately, all hospitals, have different systems. So if one has the medical power of attorney on file, another one may not. So kind of always having that with you is important, or having the loved one carry it with them, or the caregiver carry it with them. And then estimating possible future care costs, in terms of what we talked about before, what kind of level of care. We talk about levels of care, independent living, assisted living, or, really total care nursing home. And kind of talking, it's important to know when planning, right, what are the resources available to the person who has dementia or has the significant illness that we're really trying to plan for right now. And you can also think about, this care planning it's not just something that comes up in dementia, right? A lot of us need to do these things as we get older and as we have kind of planning needs and thinking about end of life and how we'll really take care of ourselves at that point. So seeking advice of professionals, is that someone who can help with estimating those costs? Either talking to a social worker or case manager might be helpful, but also talking to doctors who might, if it is the dementia diagnosis, what do they see in the future for care needs, those kinds of things. And then sometimes even taking, a lawyer might be someone you talk to when it comes to a will or power of attorney or things like that. And then exploring the local community resources, which we'll have quite a few at the end of the presentation today to help with kind of understanding what community resources are available. Okay, and so we're moving along. Now we're going to talk about the legal documents, which is really, I think, kind of sometimes like a big part. And again, this is not just unique to dementia. Again, all of us really need to know about these legal documents when we're thinking about care planning, and then in general planning for late life. And so here we're going to talk about a few. Let's see. So legal documents should be copied and stored in familiar place. I said that already once. Here's another reminder, because it is important to have. There have been many situations that I've heard of and kind of seen also when, really these important documents are not present. And so it's kind of having to wait until someone can get them to the hospital so that they're on file. And so just an important, again, reminder to kind of keep it with you. If you have like a health folder of like medications, maybe the medical power of attorney sits in that folder too. And let's get into it. What is a power of attorney? A power of attorney allows a person to name another individual to make decisions when they're incapacitated. So again, when they don't have that capacity we talked about before. So when they're unable to understand the information and make the decisions on their own, and then understand the result of those decisions. So again, the power of attorney only becomes active when the person does not have capacity or is incapacitated. So that is an important, unique thing about the power of attorney that I feel a lot of people sometimes don't remember, is that it only is active when the person doesn't have that capacity. And capacity usually is something that's determined by a physician in the hospital. Usually that's how it happens. And that's kind of most of the time when the medical power of attorney becomes active. Then there is also a financial power of attorney, which is, again, only becomes active when the person does not have capacity or is incapacitated. banks should usually have this on file. So if there's, when we were talking about bank accounts and planning earlier and having statements, if someone has accounts in multiple banks, you're going to want that financial power of attorney on file with each bank that person communicates with and does business with. And then for the medical power of attorney, really, we talked about this already quite a bit. Sometimes it's called an advance directive or a healthcare proxy. Again, it designates a person, individual who carries out wishes and desires for healthcare. And so that person might be different from the financial power of attorney. Those don't have to be the same person. And then sometimes, like, there is a general power of attorney. It's often suggested, though, that you really have both a financial and a medical. And especially kind of if it's not the same person, you might have a loved one that you feel knows more about healthcare. You want to trust them with that, or someone that knows more about accounts or business or finances. You want them to be the FPOA, or the financial power of attorney. And so important to kind of have those documents, again, copied and stored. And really, this is, again, something you'll do early on, and because, you're not going to maybe need it in those early stages of dementia, but again, just having it designated while the person can help make those decisions, who they want to be these people making decisions for them when they can't, that's important. And so again, the medical power of attorney carries out wishes and desires for healthcare. Oftentimes it includes end-of-life decisions. So does that person want to be resuscitated? If, for instance, their heart stops, they don't have a pulse. In the end of life, do they want feeding tubes? If, for instance, they can't, the dementia oftentimes can result in people not being able to swallow at the end of life and in the late stages. So talking about, does that person eventually want a feeding tube and artificial nutrition? Do they want, the resuscitation? Do they want maybe pressors even sometimes? That's a specific medicine that helps the heart beat when it's very weak and can't beat anymore. And so these are things that can start to be talked about, right, in these early stages, although it's hard to talk about, right? It's hard to not only get the diagnosis, start processing, and then talk about these things. It's hard. So we're not saying that all this is easy, but it is something important in order to kind of still be respecting that person and their wishes and what's to come. And so the other legal documents we'll talk about too today, the living will. The living will, as it says, is something that is effective while someone's still alive. It is also called an advance directive, just like the medical power of attorney per se. This often can designate a person, but the medical power of attorney, that is a designation of a specific individual. And they're very similar, the medical power of attorney and the living will. The living will just may have more information about what wishes does the person have with medical care and end-of-life care, just like what we talked about, the resuscitation, the pressors, the feeding tube, things like that. And then versus a will, which, really all of us will have at some point. Hopefully it'll, really important to have, just that way when you do die, there are already something in place to communicate what your preferences are for designating things to loved ones and property or finances and things like that. This, again, the will doesn't usually really talk about communicating healthcare preferences. It's usually really about belongings, finances, property, things like that. Whereas a living will does usually talk about end-of-life wishes. And a little note about guardianship, which comes up, and I've had people ask questions about it in the past during our series. Guardianship, also called conservatorship in some states, is a process in which an individual is appointed by the court to make decisions about a person's care and property. And this is usually because that person no longer has the capacity to make decisions. And usually this happens because there's no medical power of attorney, for maybe for reasons based on either the person is really isolated from their family, loved ones. They don't have anybody who's willing to kind of come in and make those decisions for them in their best interest. Or it's because the family or loved ones can't agree and it's sort of contentious and people are not agreeing on what should happen. So usually the courts get involved. Now, in the state of Texas, it can take quite a long time. And so usually sometimes there's a proxy of someone who kind of acts as the interim guardian while this court process takes place. Usually they try to make that person, the proxy, and the eventual guardian someone that's close to the person, a loved one or next of kin, family member, even a friend, if there's a friend nearby that really cares about the person and wants to be a part of their care and making decisions for them. They will often be helpful in the proxy, and then eventually in the guardianship, they may be the person designated as the guardian. Now, if there isn't loved ones, friends involved, the guardian is eventually and the proxy are designated by the state. So there are people that kind of are trained to be guardians for other people to kind of help make good decisions about their healthcare and property and life. And so it involves, this whole process involves doctors and lawyers. Of course, the person who's getting the guardian has to be examined by a physician and deemed to not have the capacity to make decisions about their care and property. And then, of course, attorneys are involved in making sure as well throughout the legal proceedings. And again, it may take a long time for this process to go through. It's important to bring up because it does come about often in dementia care sometimes if there aren't really loved ones or family around, or if those legal documents we talked about haven't been discussed or filled out or gone through, and suddenly the person doesn't have the capacity to make decisions anymore. Again, an important reason why early planning can help prevent this process, prevent guardianship from having to take place. And so again, examining the specific LGBTQ considerations in care planning will be kind of where we end today. So what is important for LGBTQ people to know about care planning? Everything we already discussed, but then what are more other important things to take away from today too, which are because of a history of isolation, we think, and persecution and kind of our social society's kind of treatment of LGBTQ people, they're at greater risk for needing a guardian, because a greater risk for kind of having that isolation from family, where they may not have next of kin available to kind of help make these decisions, or the increased risk of homelessness, of dealing with chronic medical issues, of dealing with kind of issues with discrimination, so that they may be at a greater risk for homelessness again, or not having the people around to help make the decisions. And of course, legal documents are going to be important, because in order to recognize families of choice who may not necessarily be next of kin, which is kind of designated usually by states, and in Texas, I believe it goes, of course, partner, spouse, or then family, then siblings, then siblings, then parents, then cousins. It goes down, there's a specific list that it's used. And so that is something that's really important for LGBTQ people, as for not to have to fall to that default of the state list. You want your families of choice recognized, very much so, because if they know your best interest, you want them making the decisions for you when you're not able to. And so getting those legal documents like the power of attorney completed early on and having that on file and copied, that's really important. Now, talking about the different resources that are available, the Alzheimer's Association, even if your loved one doesn't have dementia related to Alzheimer's, it's still a great resource for dementia. All types of dementia. The 24/7 helpline is great. And then this specific link here is about financial and legal planning that they have. There's also a large comprehensive list of resources with Dementia Friendly America, which is an organization that helps different cities in America become more friendly to dementia. So that means, do they have resources there for care planning, caregiving? It really goes and helps cities understand, like, look, you may have this huge gap in helping with age-friendly care. So let's help you get that figured out and create more resources. And then there's the Texas Department of State and Health Services, which has a lot of great resources in terms of they have actual documents available for you, which I think will come up on the next slide, to kind of a sample form of a medical power of attorney so that you might go and fill that out. And you actually don't need a lawyer in the state of Texas for a medical power of attorney. You need 2 witnesses or a witness and a notary. And so, again, you might want a lawyer to help you look through it just to make sure it's all correct. But what's great is that State of Texas website has sample forms for you. And then there's the Family Caregiving Alliance, great for caregiver resources and education. And then there's the National Resource Center on LGBT Aging. And SAGE has a 24/7 elder hotline, which would be great for resources as well. And then they specifically have 2 Texas resources, which was great, which is that link there. And then this is what I was just talking about, the sample forms, and then information about each one. And then here are Houston legal aid resources that may be able to help with reviewing wills and power of attorney information. And then this is Lambda Legal, specifically an LGBTQ legal organization. They do a lot of policy work kind of on the national stage, but they also have some other resources available too. So another good place to look for. And then if you all wouldn't mind, I'll put the evaluation link in the chat. And if you have questions, here's my email. And thank you all again for coming today.